Good afternoon and greetings from the World Health Organization. The theme for World Hearing Day 2024 is about changing mindsets and how changing mindsets is really essential to making ear and hearing care a reality for all. To start with, I'd like to share with you a real-life story that was told to me by a colleague back from India. And this story is about a young man. Let's call him Amit for the sake of calling him something. So Amit is a young man in his, I think, early 30s, living in a big town of India. And the story starts about 7-8 years back when Amit started working at a call center at a BPO, where he had to spend most of his time, all of his working time, talking to clients and customers over headphones and earphones. At leisure, during his leisure hours also, Amit enjoyed really listening to music over his headphones and playing video games occasionally. After a few years of working there, Amit started noticing that he was having this ringing sound in both of his ears. And he just ignored it at first and didn't bother. But when many months had passed and it was still persisting, even increasing, so he went to his family doctor, whom he had been going to since he was a child, and told him about it. And his family doctor suggested some lifestyle changes to reduce his stress levels and all, which of course can contribute to tinnitus. Good advice all around, but it didn't really help his tinnitus. And after a couple of years, when Amit started noticing that he was also having difficulty in understanding what his clients were saying and he needed to ask them to repeat, he decided to visit an ENT in the same town. So when he went to the ENT, he had a hearing test, and it was evident that what he had was hearing loss and hearing loss due to noise damage in both his ears. He was advised to use hearing aids. Amit was completely stunned and shocked. Hearing loss? Isn't that something that happens only to old people? And hearing aids? I mean, how could he go wear hearing aids and go to work? That would be impossible for him. And so he went back and kept doing what he had been doing. Another couple of years passed, and his problems just grew worse and worse, and he had no option now but to come back, get fitted with hearing aids. And then, of course, his hearing became better after a few months of using it. He felt definitely better. He was able to live with this tinnitus also better. But what Amit's story or his experience points us to is really the importance of changing mindsets. Because let's look at the barriers that Amit has faced in his hearing journey. So firstly, the barrier of his own misperceptions and stigma, misperceptions and ignorance about the impact of sound on ears, and that tinnitus could be an indication that needs to be explored for hearing loss. And even the fact that, well, hearing loss could actually happen at any age. Also, the lack of correct knowledge among the healthcare provider, the family doctor that Amit went to. He did not properly guide him to take a hearing test and to seek the care that that Amit needed. And that was due to his own lack of knowledge and capacity. And lastly, the societal stigma that influenced Amit's decision to delay accepting care and start taking really any precautions for a long time. The story and these barriers are not exclusive to Amit. They are significant contributors to the fact that less than 20% of those who could benefit from hearing care actually use these services. The fact is that in the field of hearing care, we have all the solutions. We have all the solutions to prevent, to identify, and to address hearing loss. Any level of hearing loss at any stage of life, in any setting, can be addressed. And yet, what we see is that the prevalence of hearing loss and unaddressed hearing loss continues to rise steadily. Now, the framework for addressing this growing need has been provided by WHO in the World Report on Hearing that lays out the concept, the strategy of integrated, people-centered ear and hearing care. What WHO has also done is provided a whole set of technical resources for how to assess prevalence and causes of hearing loss, how to plan for hearing care, how to train healthcare providers, how to screen, how to prevent hearing loss, how to check hearing yourself, what kind of hearing aids to provide, and what rehabilitation services are required, and how can hearing aids be provided in low and middle income settings. But what we also need, in addition to all the health system interventions that are laid out here, is really concrete action to address the misperceptions that are prevalent in society, to improve knowledge, and to mitigate stigma. The barriers that Amit faced, we need to turn these around through informing, through capacitating, and through including. Informing people about healthy ear care practices, about hearing protection, about the importance and possibility for timely care seeking. And for this, WHO makes available a number of resources about healthy ear care, resources also to bust the myths and misperceptions about hearing loss and address stigma. But also, we need to build capacity amongst primary and secondary level healthcare providers through systematic training and through availability of equipment to them. WHO provides also resources for these in the form of a fact sheet which lays out, gives in brief the information. Why should all healthcare providers be interested in this, and what can they do about it? Also, a training manual that provides guidance on how healthcare providers, non-specialists, non-ear and hearing care specialists, primary level providers, family doctors can be trained. Also, tools and resources for fostering inclusion through becoming hearing loss friendly, and also through highlighting the stories of people with lived experience of hearing loss. So addressing stigma. On this World Hearing Day, WHO calls for strong action from governments, from civil society partners, from developmental agencies to inform, to capacitate, and to include. Inform the general population, capacitate, build capacity amongst healthcare providers, and to ensure inclusion of people with hearing loss so that ear and hearing care can become a reality for all. Thank you.